Hello, I want to share a few thoughts with you about current medical practice. Now, you have been familiar with the situation where the doctor is the all in all. I take decisions for not just himself on the basis of his knowledge and what he's assessing the case of the patient to be. He also has had to take decisions for the patient himself. But all that has changed. In modern medical practice, the patient has more important and significant roles to play. And that's what we call patient-centered care. Now, the role of a physician is, of course, to evaluate the patient clinically, align his findings with his knowledge, and then interpret that in the context of what we call guideline-directed medical therapy for many of the diseases and in very various specialties, cardiology, endocrinology, and nephrology, and so on. Now, having determined the best approach that's suitable for a particular patient, the patients also need to be educated, informed, they can ask questions regarding those decisions. As a matter of fact, it's expected that a patient does his or her homework as well. I mean, there are tools, online tools for, obtaining information regarding clinical situations, especially in the era of artificial intelligence. I must say also that this tool should not be used by the patient in isolation. It has to be under the guidance of his or her managing doctor. So the important thing is that the patient has information relating to what his or her clinical condition is, and they can engage his doctor productively with the information, and together they can put heads together, and on the basis of the doctor's medical knowledge and treatment guidelines that have been derived from extensive high-quality research, they can arrive at what is optimal and best for the patient, and therefore the patient stands to benefit, not just in terms of the clinical diagnosis and treatment approach, but also being actively involved in managing his own condition. And I think that ought to give the patient a sense of, fulfillment and motivation. So in the end, he, recovers a lot more fully than he otherwise would have if he was left to a doctor to take all the decisions. I hope this helps. Thank you and God bless.